Greetings, one and all present here. Uh, this is Anup Sharma, and I'm a PhD scholar and doing my PhD under guidance of Dr. Nitin Gupta, who is my guide here as well as co-author for this paper. What I'm going to present here is on COVID-19 and how it has changed the retirement planning priorities. So how equations changed regarding retirement planning. So my topic is COVID-19 redefining retirement planning priorities. So just to give you an introduction about my topic. So what I would do is throughout this presentation I would be going through these slides. I would be first giving a brief introduction followed by review of literature. Then I would be discussing model with you. Then I would tell you a bit about the research methodology used for the study. Then there would be analysis followed by result and conclusion. So this would be logical order of my presentation. Okay, so just to give you an introduction about this insurance, not about this retirement planning. Uh, the thing is, this study was done in Indian context, and there were certain studies which were conducted by Economic Times and different channels, and what they have found out here is, if you see these statistics here. Almost half of the population doesn't have any retirement plan, so they don't have any retirement plan. And followed by that, if I talk about how many people actually think they are prepared, so more than around 60% people think that whatever planning they have done, that's not sufficient enough, right? Similarly, if I talk about how much money if I'm devoting towards my savings or investment which I can use during my retirement, so it's on an average around 40%, right? Whereas people with no estimates of retirement purpose, I don't know how much amount I'm going to use or how much amount I would need during retirement, that is somewhere around 48 to 50% of the population. And those who have some idea think that maybe 50 lakhs amount is sufficient enough for them. So it's a ballpark number. They just have most of them guess. And when it comes to retirement, then actually it turns out to be the right decision or the wrong decision. So my study here is this particular study is what is the relation which is established, what is the criteria which is used by an individual to make a retirement plan. If that plan is successful, he would be satisfied with that, right? So how much satisfied is he with the retirement planning, and how this equation of different factors, this retirement planning and the retirement satisfaction can be is affected by pandemic like COVID-19, right? So that is what my study is. So moving to the next part here. So I've done quite a review of literature here, and some important papers I have mentioned here. So for example, the first one tells us about I know different factors like consumer daily lives, health and social activities, different things which were affected because of COVID-19. So multiple papers cited that. Similarly, talking about how much money I would require, how much corpus is required for a well-being or satisfied life. Again, for that, there are multiple papers published, and they have studied multiple factors which can result in an appropriate amount during my retirement. So the third paper says a bit about the different type of goods or different type of options available with me. So no options related to financial planning or financial resources, or maybe related to the health resources or related to the social resources. So there are different resources which can control which control this retirement planning. So few papers on that as well. Then retirement satisfaction, its relation with health and financial resources, social resources, emotional motivation resources. So studies also done by this researcher which is mentioned here in this review of literature. So, along with that, there were certain studies which were very specific about the pandemic and how it affected. So, yeah, effect of pandemic on I think in some countries where people are dependent on the social system or government system for compensation, or maybe what is effect of this COVID-19 on the premiums which people need to pay, right? These premiums are increasing because there was load on Medicare, and this is eventually going to affect this premium payment in future. Similarly, the next one is the mentality, the attitude. For example, how this pandemic have shown people their vulnerability, and what they need to do to cover such things in the future. So studies are done for that also. Similarly, pandemic effect on retirement risk and planning equation. So those effects were also studied by researchers. So some important papers were listed here. So under my study, what I've done is, this is a model which I have used here. So just to highlight, I have what I have said is, there is a retirement planning, and there is a retirement satisfaction which I would be getting. Now there are multiple factors here, like financial resources, health resources, social resources, emotional resources, and motivation resources. So this model was adopted, partial model was adopted by this published paper. And in addition to that, there are two things which I added into this model. One is how this pandemic, or how this COVID-19 thing is going to affect this model. So is there any moderating effect of this thing on the existing model? One. And second, whether this model, the load, the effect of this retirement planning on these factors, or these factors affect on the retirement satisfaction, what is that effect in Indian context? So these are two additional things which I have added on the base model adopted from this paper. So based on my for this research, what I've done is, I went for the survey where I chose retired personals. So retired personals, including those who are from defense background or non-defense background, those who all have retired, those are the people as a part of my sample. And I tried to keep fair proportion of both genders, but I got somewhere around 42% of women. Similarly, age range is somewhere around 50 to 68. So this is the age range which I got in my samples. I try to get mix of or different education qualification, but most of people are the graduate people, those who graduated during that time. So the model which I used here was suggested by Floyd in 1992, and there was one improvement in that, which was this model was basically based on mediating factors, but what I have done here is the combined effect of moderation on mediating factors was considered in this study. So moving forward, so out of my study, what I've found here is, let me show you this results first. Yeah, so these are the results which I got here. Results like I studied this effect on a set of people who were not affected because of COVID-19, and set of people who were affected by COVID-19, just to see the moderating effect of this pandemic, and the different factors which is studied here, the same factors, and the respective beta is mentioned there. As you can see here, I didn't found significant relation, significant value here for emotional resources. But when I compare this thing with the set which is studied after those who were affected by COVID, when I compared with this data set, what I found was there was a positive moderation which happened here. So the positive moderation is highlighted by the green color, and the negative moderation is highlighted by the orange color in this particular table in here. So it can be clearly seen that because of the pandemic, this effect, effect of financial factor and effect of health factor. These two factors were affected by retirement planning. Whereas when I talk about effect on retirement satisfaction, so yes, financial resources affected the retirement satisfaction in a positive way, whereas the social resources affected my retirement satisfaction in a negative way. So these are the resources which can be categorized into these 5 different categories: financial resources, healthcare resources, social resources. For example, social resources are the support which you can get from your family or from your community. So that's what is the effect of COVID-19 or pandemic to those who were affected and those who were not affected. So it can be clearly seen from this discussion that this observation is clearly visible there, that the positive moderation is there on this side. Retirement planning effect on financial resources, and financial resources effect on retirement satisfaction. Positive moderation was there. Similarly, positive moderation was there for retirement planning effect on health resource, whereas the negative moderation was observed of this pandemic on social resources affecting retirement satisfaction. The same thing has been written here. So this is my conclusion. Based on this study, it can be clearly understood that because of this pandemic, your health factors and financial factors as well as the social factors are those which are affected. Some of these factors are affected by your retirement planning, and in some cases these factors are affecting your retirement satisfaction at the retirement. So that's my conclusion part. This is a list of references which I've used for my study. So it's listed down here. So that's all from my side, and thank you very much.